So my name is Dr. Narjust Florez. I'm a thoracic medical oncologist at Dana-Farber and at Harvard Medical School. I specialize in young patients with lung cancer. So let's define the term young. Young means patients diagnosed with less than 50 years. It's often an excluded and forgotten population. We don't associate young patients with lung cancer, leading to delays in diagnosis because most people think it must be a lymphoma. Most patients that are young with lung cancer tend to have genomic mutations. That brings an additional layer of financial toxicity, as targeted therapies are very expensive and often have very high copays, and many of the young patients don't qualify for the drug assistance program because they're above the poverty line. A lot of young patients have high psychosocial needs because the healthcare system, particularly around lung cancer, has not been designed for them. Let me give you a few examples. We often have very strict schedule for our patients to get the chemotherapy infusion 8 to 5. But these patients need to take time off work, which is added financial toxicity, to get their infusions. So we are making changes to have infusions in the weekends, 6 p.m., 7 p.m. Additionally, when you're diagnosed with lung cancer at young age, you're completely isolated. You don't know anybody who has been diagnosed with lung cancer. You only hear about breast cancer. You're isolated from your peers. So young patients with lung cancer have the highest incidence of depression and anxiety. And often these patients are labeled as anxious as a choice. But when you are 40 years old, you know you have limited time on earth. It's appropriate anxiety, instead of us trying to gaslight our patients that their emotions are too big. How will you feel if you're told you have 2 years to live and you haven't even had children yet? So there's 3 big issues in the psychosocial needs. First, high levels of anxiety and depression. Second, high levels of financial toxicity, because they have to keep their jobs to keep their insurance. They don't have lifelong savings. They don't have a 401k they can withdraw money from. And third, who cares for the caregiver? So patients between 30 and 50 years old are often the caregivers that drives this country. Let me explain that. They're often the parents, and they also take care of their parents. So they provide childcare and elderly care. But when they get sick, who cares for the caregiver? There are no systems in place. They suffer in silence because they're supposed to tough it up. So we need to understand that young patients with lung cancer have the highest needs and that we need to be there for them and also adapt to their preferences. I'm a millennial. I don't like when people call me, text me. So we need to adapt to the communication preference that patients have. This is only the preliminary analysis. We're going to continue to study this, and hopefully next year I'm back with you to show the final results of the study.